So if governments across Canada were to fully embrace the well-being framework in their decision-making and budgeting, how different could the world look in 50 years?
Well, I think I would say I don't think that we should fall into the trap of thinking that if governments do this, that's the answer to the problem. I think well-being of a society as a whole of society effort in which government can and should play a leading role, but I don't think we're the only actors. And I think in some areas, we're not even the most important actors. But all that said, like, I do think if governments were to sort of do this, like, kind of well-being thing in a serious way in a sustained way over time, I think that it would lead to a situation where, for example, some outcomes weren't consistently privileged over others. Growth in GDP over the health of the environment, for example. I think that those trade-offs would become much more real. There might be more nuanced decision-making about that, or there would be more nuanced decision-making about that. There may be forms of growth that we would not want to pursue as a society because we would have a better understanding of what the trade-offs were and we would equally value those trade-offs. And I think that would be a positive outcome. And then the second thing that I think we would see is I think we would see a lot less inequality. It's not the richest nations that are at the top of the world happiness rankings. It's the most equal. And I think we need to take a lesson from that inequality itself is an independent driver of poor well-being.
I'm not very interested in the long-term horizons. I spent some time working with actuaries, which really influenced my worldview. And their toolkit is really helpful in modeling long-term trajectories and sort of bringing forward into today the long-term consequences of our decisions now. So I think about it like if you're driving with a GPS and the GPS tells you your expected arrival time is whatever time, and then you take your foot off the gas and you stop, then your expected arrival time adjusts. But what I love about the actuarial toolkit and about those long time horizons that I think can help with some of that sort of political calculus of working in the shorter term results space is that it sort of brings forward those long-term impacts and consequences. In terms of what I think things would look like aspirationally, if we were better focused on the longer term, I think there again, you do broaden that solution frame. It really helps with thinking more about sort of those asset building initiatives that really focus on sort of building up, communities' capabilities in sort of a positive sense where you don't have an immediate and measurable impact necessarily, but it sort of moves the dial in ways that gather strength over time, that build sort of momentum and energy that people want to sort of be part of. And once there's sort of a nub of some momentum, then more people tend to want to be part of that good thing. I'd love the answer to be everyone's going to get enthusiastic. They're going to see a vision. Everyone's going to get on board and we're going to change the world together. And maybe that's true. But I think in order for that to be true, it requires that sort of sustained commitment. It requires the actual focus on execution, implementation. So to me, it's that really hard, sustained work of building systems that support you to course correct, that give you the evidence-based feedback to be able to sustain that continued momentum.
50 years is not a long time for generational cultural identity and integration of community and impacts of parental trauma and all those things to factor in. But there are definitely some things that could change quickly in 50 years. If everyone had the same access to education and technology or even internet, that could make a huge difference critically, quickly, I think measurably. Healthcare, again, access to healthcare, and again, maybe one that takes longer is the barriers of racism in healthcare and fear of healthcare because of those systematic factors. For First Nations governments, the barriers to embracing that well-being in their decision-making factors are, even if the First Nations government had it right and wanted to do it, they're not in a position because of the system we're in Canada where we got to that they can do that. So that would be the first thing that would need to be changed. The capacity to do that for a First Nation government to have the economic and human resources and the capacity and the training and the systems writing a constitution for a lot of these nations. I mean, is where we're starting, or having a constitution and then the resources to implement it and staff people to turn that into policy and law and programming. And finally, in order for any of those things to happen to a First Nation, the federal and provincial and the rest of Canada, the governments need to integrate those perspectives into their decision-making powers to create truly that nation-to-nation relationship with First Nations and give them the capacity to make those decisions, build up their definition of well-being and those indicators, be resourced to do that, train their people.
Well, I think there's potential to have quite radical change in a very positive direction. Yeah, and I think what we're measuring can really end up having quite a profound impact in how societies are organized, how community members interact with each other. So I think it often depends on the community. If a specific community wants to see that radical change, I think it is possible. In kind of having a distinct framework in vision for what we want to see in the future can really lead to some pretty tremendous results. I think some communities may not be ready to take that full leap, and they may be more focused on an incremental approach. But I think what's really important is that each Indigenous community can really make that choice for themselves. So I think there is significant potential, but oftentimes we may have to break down some of the maybe siloed thinking that we see within certain levels of government, even within some aspects of academia, to really kind of realize a new reality in a new way that the people can live in a way that maximizes their well-being.